Alright, hey guys, we're back and we're doing the Fraxel treatment now on the neck. And this is one of the things I really wanted to point out, that as you age, it's very important you not only treat your face, but you treat your neck, your chest, your hands, your ears. Some guys bald their scalp, because if you don't do that, higher risk of skin cancer, and also you can then look a lot older than you are because that one area wasn't treated and ages quite rapidly. So we're treating her neck, we're treating the sun damage there. It's also going to get a little tighter because we did the Morpheus treatment. Plus any fine crepiness will improve to the overall texture of the skin. And you can see with the Fraxel, you get red like a lobster. That will go away in the next 7 to 10 days, probably even a little sooner than that. It doesn't look so bad, it just looks like a sunburn. But I just wanted to point out that it's very important to treat the neck. And we're going all the way across it, not just doing the front of the neck, I'm going all the way to the back, all the way down, and past, because I really want to encompass all the areas that could have the sun damage. Last one. See, we're going all the way up, covering all the area completely. And this rolling scanner makes it so the energy is delivered really easily. Very aggressive lasers like CO2 have a lot more downtime, and sometimes, honestly, turn all the way to the left, are a little more risky in my opinion. We do them less and less nowadays. On the neck and chest area, we do more of these fractional lasers because they have much less downtime and or risk, and they build over time. So we're going all the way. You guys see this?
Beautiful. It blends in the spots.
Blends in all the spots.
From Morpheus, right?
Yep, it's going to blend in the Morpheus, which is doing the deep needling. You can't have the Morpheus perfectly aligned, because it can cause a little bit of a burn in between. So you have to leave a little bit of a spacing, but this is going to blend. And remember, Morpheus is only deep. There's nothing really on the surface, even though it's red right now. She's doing great. You see how we're encompassing the entire neck all the way around.
What kind of anesthesia did you use for this case?
Talk anesthesia. It's a joke. You guys know what that is? It's comedy. We're just talking so that she doesn't remember that she's getting a painful treatment done. No, we're doing just topical anesthesia, ice packs, cold air being blown currently, and then also we did nerve blocks on the face. I think the nerve blocks are a nice touch because they don't really increase the downtime that much at all, actually. They just make a little bit of swelling, but no big deal.
What does Fraxel good for?
This is great for sun damage, for fine wrinkles. You see these brown spots here? We want to get those browns and turn them upside down. Got to get rid of them. We got to lift them. It's pigmentation and sun damage. And it's going to do a lot fine wrinkle improvement. It's just going to overall make her look better, which is why we combined it with the Morpheus to get some tightening. All right, last one. And the key is right afterwards we apply PRP, which is what we're going to do right now. Perfect. So I'm going to give you, hold on one sec. I'm going to give you this cold air. Hold this in your hand. Blow that on your face. And I'm going to show everybody what we do. Okay. So she's going to blow, blow, blow. Perfect. Get that cold air on you. And we're going to take the PRP that we have, and we're just going to apply this onto the skin topically. Now normally we would microneedle this in, but since we already did the deep microneedling, we don't need to do that. We just need to get this onto the skin. And the cold air really helps decrease a lot of swelling
Is this okay to use on Asian skin?
It is, but obviously we have to assess. Not all skin types, regardless of ethnicity, are the same, and so it depends on the Asian skin type. But yes, you can use Fraxel on even darker skin types, depending. So she did great. So you see we're applying the PRP right now for healing. You can see it's a clear liquid that comes from her own blood. But this really has a lot of growth factors in it and anti-inflammatory cytokines and stem cells that help heal the skin. Now the last part we're going to put on in a second, a mask. So in the meantime, I'm going to let her cool, but that's the healing protocol and that's the tight and bright procedure. Bye guys.